For a year now, we've tracked the virus in numbers.
Yeah, which arm would you like it in?
Any.
Which one? Are you right-handed?
And in Hull today, another dose that takes us closer to Monday's 15 million target.
Didn't feel a thing.
And a reminder from Margaret Hopkins of the hope the vaccine brings.
And I brought you a thank you note as well.
Oh.
Not least for those whose lives have been on hold this last year.
Oh, thank you. Thank you.
Bye.
She nearly made me cry. Never cried before.
Can you get me in the bioreactor in shop?
Not a thank you card, but a selfie sent from the Prime Minister to the Health Secretary.
I just want to send that to Hancock. Very good, thank you.
As he visited a biocampus in Teesside where another vaccine, Novavax, should soon be in production, for the first time there were some details about the unlock.
Starting with schools, we very much hope on March the 8th. That's got to be the priority.
After schools, he said, then shops, then pubs. There were cautious caveats on timings, but he said we can expect more details on the 22nd of this month.
Could we be drinking in pub gardens, as the papers suggest today, in April?
Well, I'm gonna, if you don't mind, I'm gonna ask you just to wait a little bit longer. Give us some more time to look at the data about what's happening, look at the way the numbers are coming down. Study also, I think very importantly, the efficacy of the vaccine. We have to be wary of the pattern of disease, and we don't want to be forced into any kind of retreat or reverse ferret, if you see what I mean.
Reverse ferret, the latest mammalian metaphor from the Prime Minister not so long after saying whack-a-mole was the strategy. But there is a reasonable point in there. Because if the timing isn't right, if the infection rate is still too high, unlocking could mean another surge in cases and yet another relock.
We just need to be really careful about relaxing these restrictions too quickly. And I have to say, our frontline leaders get really nervous when they hear some people starting to suggest that there should be an acceptable death rate from people in groups 5, 6, 7, 8 and 9 in order to trade off for opening up the economy. We think that the health of the economy depends upon a healthy nation.
You might have to do the cooking.
While the first unlock was without new variants, this time we have the vaccine. But even with the most at-risk protected, it's clear the unlock won't happen all at once.
Claire Fallon reporting. Well, joining us now is Professor David Salisbury, a vaccinologist and the former director of immunisation at the Department of Health. Good to speak to you again, Professor. The government, phrases it very carefully. They have offered the vaccine to 14.5 million people. Do we know how many people have actually taken up that offer?
I think the important number is the daily report of the totals that have been vaccinated, and 14.5 million is a great result. I mean, that we can't take anything away from that. I just have to say that's really fantastic. We've got obviously a long way still to go. Well, I find it frustrating to hear about numbers vaccinated and numbers offered, because the numbers offered isn't really the issue. It's how many people have we vaccinated, and 14.5 million is a great result so far.
So why do they insist on using that term offered, I wonder?
I don't know. I mean, it doesn't mean anything. We need to know what the target population is that we want to vaccinate, and we need to know how many of them we do vaccinate. The offer bit is a bit hedging your bets.
OK, so, I mean, it is an astonishing result. Why have we done so well? Is it the way that we've rolled this out? Is it the kind of network of GPs and vaccination centres? Explain this to us, why that is such a success.
The UK is really good at doing vaccination, and I think that that's the underpinning of the process. We've had supplies, and supplies of vaccine are critical if you want to make a campaign to be a success. We've got really good primary care facilities where every patient's details are known, so that you know who are in the high-risk groups based on their age, based on their comorbidities. We've done extraordinarily well at mobilizing both primary care and vaccine centers to get so many people vaccinated in this period of time. It's a great result and a credit to everybody at every level of the process.
As I mentioned in my introduction, there are the glimmers of optimism. There really hasn't been an awful lot of optimism around in recent months for obvious reasons. Do you think that's dangerous at the moment? Because, of course, the pressure to open up society will grow exponentially as we vaccinate more people.
I think we do have to be very careful, and it would be wonderful to say, you know, when spring comes, whenever that is, everything's going to be wonderful. We can go back to life as it was. We can go to restaurants and be shoulder to shoulder. We can go to pubs and have a packed pub for a wonderful evening. I just don't think it's going to be like that. I think we have to go very carefully because we don't want to be in lockdown, unlock, lockdown, unlock. And this virus will keep coming back. And we mustn't assume that just because we vaccinated so many people, it's going to magically go away. It's going to be with us for a long time, and we need to progressively adapt and not in jumping steps that leave the risk of it coming back again.
So briefly and finally, when Matt Hancock says that we'll learn to live with it like we learned to live with the flu, is that slightly misguided? Because it's different to the flu, isn't it?
It is different to flu. I mean, I think there will be similarities. We may well have our flu vaccine every autumn and our coronavirus vaccine at the same time. And in that way, it could be like flu. But it kills more people than flu does. And I think it may be that living with flu will be more like coronavirus in that we'd never used to wear masks. We didn't used to have social distancing during the flu season. Maybe that's the change.
OK, maybe it is. Professor Salisbury, thank you very much indeed for coming on the programme.
Thank you.
Now, bosses at Heathrow Airport have warned that the government's hotel quarantine policy is not ready. From Monday, travellers arriving in England from 33 high-risk red list countries will have to pay to stay in quarantine hotels for 10 days minimum. The scheme is intended to prevent the spread of possibly vaccine-resistant strains of the virus. But airport bosses and trade unions have said that the booking system isn't ready, and there remain issues about staff training and safety. Our business and global trade correspondent Paul McNamara reports.
The glamour of air travel, which on Monday meets the crushing reality of COVID quarantine. This morning, final preparations at the Heathrow Novotel, one of the hotels signed up to take so-called red list travellers. But only last night did those passengers from 33 high-risk nations find out the details of what soon awaits them on arrival.
I just snuck in. I actually have my flight booked for Monday, and so I decided to change my flight a couple days earlier.
Under the rules, red list arrivals in England must spend 10 days quarantined in a hotel room. They can only enter the country via 5 airports and, except for medical emergencies, can only leave their rooms for exercise in the hotel grounds, but that must be supervised by security staff. Then there's the cost, which is set by government. This hotel hold-up will set you back £1,750. So far, no red list travellers have been booked into this hotel, but staff here say that they're prepared and ready for their new roles. Over at Heathrow, though, there are concerns that there are still, quote, significant gaps in this scheme. Too few border guards and no detail on how high-risk travellers will be transported from the airport to their quarantine quarters. Passengers were already taking to Twitter to complain about a lack of border staff at passport controls, causing queuing for hours in busy arrival halls. In a statement, Heathrow Airport said,
"Ministers must ensure there's adequate resource and appropriate protocols in place from aircraft to hotel, to avoid compromising the safety of passengers and those working at the airport."
There's also a question of security and the safety of those who provide it. The union that represents the security staff have a list of concerns they say government still hasn't addressed, from PPE to process and policing.
Now, you have to bear in mind that these travellers, they're not in custody. They're still entitled. What happens if one of them says, well, I want to go and buy a packet of cigarettes? But what is the expectation from staff in dealing with these passengers?
The government say they are working closely with airports and hotels to manage any issues that arise and ensure the new process runs smoothly, adding the safety of all staff and passengers is a priority. For the last week, the question asked time and again to ministers was, can we book holidays for the summer? Before then, though, the issue isn't getting on a plane to depart, but the process now for when you land back.